Warehouse. Niall Dickson is Chief Executive of the NHS Confederation, representing organisations across healthcare in England. I think, Neil, that's right, isn't it?
Wales and Northern Ireland too.
I beg your pardon. England, Wales and Northern Ireland. Thank you. So could we have worked this out before the expense of sending over an RAF plane and bringing it back here?
Well, I think what it does show is, and remember, people are trying to source stuff from all over the world. It's all very pressured. People are desperate to try and get stuff. They're getting orders in wherever they can, and they're taking up promises. But the reality is, in this particular business, we know that the numbers of gowns or masks or whatever, the type, the quality of equipment is not always what it says in the box. So the promise, unfortunately, was made, first of all, that they were coming. Well, they hadn't yet got on the plane. And then, of course, that didn't happen. And then when they did sort of arrive again, there was a great fanfare, but nobody had looked in the boxes. And all this equipment obviously has to be tested before it goes onto the front line. And the danger of all this, because in one sense, look, it was a big shipment, but it was a few days supply. It wasn't going to solve all the world's problems. But the problem is it undermines confidence, especially among frontline staff. And I have to say among our members as well, the leaders of the healthcare system. And really the message, I think, to the politicians is try not to make these promises. I know they're under a lot of pressure because they're saying, when are you going to solve this? When are you going to solve that? But it really is better to under-promise and then, hopefully deliver better than that.
Yeah. I mean, I suppose on the one hand, it's great that we have very rigorous high standards in this country. And we were always told, look, as and when this shipment arrives, it will need to be checked to see that it does conform to safety standards. On the other hand, it feels like we've been played a bit here.
Well, do you mean by the Turkish supplier, or do you mean by the government? I think the answer is they're trying to source from all sorts of places.
Much was made. So in the government press briefings, much was made by the Health Secretary at the time for England, Matt Hancock, about this big shipment of stuff. OK, we've got a crisis. We're in the middle of the crisis, but we've got this big shipment of stuff coming over from Turkey, and that was going to plug the gap.
And I think there was, especially at that moment, there was enormous pressure, particularly on this question of gowns, and gowns had become a significant issue, especially around, and they're the things that are used with very seriously ill patients in these intensive care units and the rest. So there was enormous pressure on them. I personally, and we said at the time, actually, not a great idea to promise these things until they're delivered. And obviously they were trying to provide kind of assurance. But the problem with providing assurance when you can't deliver on it, or you don't deliver on it, it then has an effect where people don't quite trust you the next time round. And I think that's been a big problem around PPE more generally, that people have thought the guidance around PPE, there were lots of different conflicting bits of advice at the start, and then there was a real difficulty of supplies, especially in community services and so forth, but in hospitals as well. And making promises is just the way that you undermine it further. And I think the lesson from all this is be really cautious and setting targets of number of tests you're going to do and so on. And again, I understand about galvanizing the system and the rest. But the trouble is when that target is met or not met as people thought it was going to be met, again, it undermines confidence.
Well, we had another target yesterday, didn't we? 200,000 tests today, the Prime Minister had mentioned.
Yeah, so as I say, I can understand why they want to galvanize the system. They want to say this is absolutely where we're going. And of course, if they achieve it, they will be full of triumph that they've delivered it. But in many ways, the exact number of tests is not the issue. The issue is, have you got the right tests? Are the tests reliable? Are they reaching the people who need them? Are the staff being tested, first of all? And then, of course, we're moving into a new model where we will need many, many, many more tests in order to try and make sure that we contain the virus as we move out of lockdown.
Trace people for sure. Thank you very much, Niall Dickson from the NHS Confederation, representing England, Wales and Northern Ireland.